Today is a wonderful day. Joining me is the remarkable and brilliant Dr. Elita Šapovalova, an oncologist. I won't hesitate to say it, you truly deserve a Nobel Prize for the 60 years you have dedicated to oncology. I know you are 85 today, and I believe you are a true champion in your field. I also want to highlight that you were the first person in the world to apply cancer virotherapy in practice, specifically using Rigvir, a virus discovered right here in Latvia by your colleague, Aina Muceniece. As Aina's grandson and the one continuing the development of Rigvir, it's vital for me to learn not just how the virus worked, but about the struggles and challenges you faced along the way. How did you find your path into medicine? And how did you build this incredible 85-year life dedicated to helping others? This is truly fascinating to me. So, for my first question, I'd like to ask about your roots. Where does such a brave and wonderful person come from? Who were your father and mother? Where and in what year were you born? Thank you for being here, and we look forward to hearing your story.
Well, what can I say? My father was born in the Donetsk region. His parents had fled from Smolensk out of a great love for each other. My grandmother came from a wealthy family, while my grandfather was from a poor one, but their love was so strong that she ran away to be with him. It was a small mining town. My grandfather went to work in the mines, had an accident, and was left with a limp for the rest of his life. My grandmother had a large house with a cellar underneath. In Ukraine, they have these massive pits, and apple trees grew there. The apples were wonderful, so delicious. But when we were taken to stay with our grandparents in the summer, we weren't allowed to pick an apple from the tree. We could only take the ones that had fallen to the ground. My grandmother was terribly greedy. In 1949, during the monetary reform, she said she lost a whole sack of money, which made her even more bitter. We never heard any fairy tales or felt any love from her. My parents were born in Ukraine. Both my father and mother graduated from the Medical Institute in 1939. My father was then drafted into the army and sent to Mongolia to serve as a surgeon. My mother's roots are in the Dnipropetrovsk region in a small village called Grigorievka. Her father was a simple peasant, but he was very skilled. He had a workshop and was the only carpenter in the entire village. They had this huge cabinet there. Of course, I had to know what was inside, so I crawled in once and saw books with gold letters on their spines. They were so heavy I could barely lift them. As it turns out, back when the villagers were raiding the manor houses and taking things, everyone else was dragging away furniture and clothes, but my grandfather was carrying away books. And those books remained in our home.
That's where that curiosity came from, isn't it? Perhaps from that very moment.
Well, when I saw books like that, I've held a deep respect for books my entire life because we were constantly moving and we never had a home library of our own. Our only book was a collection of Pushkin. That was the one and only book we had because we lived out of 2 suitcases. My father was a military surgeon. He would come home in the evening and say, "We're leaving tomorrow." And my mother would quickly, just like that, pack those 2 suitcases and we were off.
So, you were born in Mongolia, correct?
Yes, my father and mother graduated from the institute. My father was drafted into the army and sent to Mongolia. And I was born in Mongolia. I don't remember much from there. There's only one fragment, a river where horses are standing with their legs in the water and everything reflects so strangely, with fish swimming between their legs. The horses stand calmly, the fish swim peacefully. And nearby stands a Mongolian man with all his people, and they were ready to give up everything just so the soldiers wouldn't catch the fish, because to them it was sacred. That is the one piece I remember from Mongolia.
So, it turns out you were a child of the war.
Well, during the war, yes, but we were in Mongolia. There were battles happening, and all the families who were there were evacuated. Everyone was evacuated because the warfare was still ongoing at that time.
So, in a way, the horrors of war passed you by.
Yes,
But I'm thinking about your grandmother, the one who wouldn't let you pick the apples.
yes.
Perhaps she lived through the Holodomor?
No, it was just in her nature. My father and mother would go on vacation to Gorlovka, and then they would visit my mother's father in Grigorievka. Her sister, Nadia, lived there. She had worked as an agronomist for the entire district throughout the war, but she couldn't get married because all the men had gone to the army, and most of them had perished. So, my parents decided to take Nadia with them to Mongolia. There was a military unit there. They thought she would find a husband there. They traveled through Gorlovka, where my grandfather and grandmother lived, and there she took a liking to one of the brothers and stayed there as his wife. He was a prominent mining engineer, and they were sent to Magadan to build some sort of mine. That's where her daughter, Natasha, was born. One time, the little girl stepped down from a chair and injured her knee, and it turned out she had tuberculosis of the knee. She spent an entire year in Kramatorsk, Ukraine, with her leg in a cast. The whole leg was plastered. When the cast was finally removed, she didn't really know how to walk yet. When a child is kept in a cast for so long, they lose the skill of walking. She would crawl across the floor, dragging that stiff leg behind her, and that grandmother would walk past, hissing at her and almost kicking her. May God forgive me for saying so. But well, it is what it is.
Well, thank God that the horrors of war passed you by. Today, we are here in Latvia, and it's incredibly interesting. How did your path lead you here to Latvia?
We were wandering around the Far East back then. I don't even remember all those villages because the military pilots were constantly taking off and changing their deployment. My father would come home and say, "Get ready, we're leaving tomorrow." 2 suitcases, and we were on our way. That's just how it was.
So, how did that journey to Latvia begin?
The journey to Latvia began like this. When my father was in the Far East, he was offered a post either in Germany or in Riga. He came home and told us about the offer, and my mother said, "Let's go to Riga." It was my mother's choice, and so we came to Riga.
And how old were you then?
I think I was about 10 years old, and right across from the station, there was a horse-drawn carriage driver standing on the corner.
And what were your first steps into medicine? You were in Latvia. You arrived here at the age of 10?
My very first steps were actually in a military hospital.
In Latvia.
No, in Mongolia, because there was nowhere else to leave me, so they took me to work with them. I would walk among the patients, and they would play with me. I always had chocolate in my pocket because the pilots were given chocolate, and they would share it with me. Since I was the only child there, they literally carried me in their arms.
So that's the key. It was through your father that you first became acquainted with medicine.
Yes, I was there all the time. When I was at the hospital, they would put a shirt on me, tie it with a bandage like a belt, and I would walk among the patients. My mother would come up and say, "Take this medicine to that uncle lying over there." I would go over and say, "Please, take your medicine." He'd be lying there with a sheet over him. I'd say, "Please, Mama said you have to take your medicine." He wouldn't move. I'd pull the sheet back, only to find he was lying with his feet at that end. Well, they would joke around and play with me like that. So my very first steps were truly in the hospital. There was no other way out. Of course, I had to go and study medicine. There wasn't even much of a choice because I was already so deeply rooted in that environment.
Yes, but your professional medical journey in Latvia, that started at the institute, right?
In the year I graduated school, 1957, it was the first year they prioritized people with work experience and soldiers. In Riga's Russian stream, there were 75 spots, but only 23 were for students. I didn't have a medal for top grades because I was quite a restless student, and my mother didn't have any money. My mother went to Dr. Hersfeld, her supervisor, and asked, "Dr. Hersfeld, help me get Elita into the medical institute." He asked, "Well, do you have money?" When she told him the amount, he replied, "For that much money, you can take a decent lady to a decent restaurant for a single cup of coffee. If you want her to get into medical school, send her to Ukraine, just not to Kiev or Kharkiv. Too many of our people there. Send her to Dnipropetrovsk. They have a very good institute. There, she'll pass the exams even without a medal because the Ukrainians have to take exams in Russian, but she won't have to take them in Ukrainian." And exactly as he said, that's how it happened. I went to Dnipropetrovsk. The most interesting thing was this. My father returned from his post in the middle of nowhere. He was sitting on a train when a woman behind him asked, "Do you have a light?" He turned around with his cigarette and exclaimed, "Nadia, is it you? Lyonya, is it you?" It turned out they had studied at the same institute in the 1930s, and now it was 1957. They met again after all those years. At first, they took me in to live with them. But she was always out on dates, and I had to wait for her to come back so we could walk home together. Eventually, I moved out. I rented a bed in a room with 4 older students. I lived in that room for 3 years and studied. The institute was excellent. I am so grateful to both the professors and the students. The atmosphere was warm and friendly. It felt like everything just clicked in my head. I didn't even have to try that hard. I finished my first, second, and third years. Then there was an incident where an American pilot crossed the border in the east where my father was serving. There was a lot of anxiety. My mother started worrying about what would happen, whether there would be a war. I was in Dnipropetrovsk, and my sister, the younger one, was in Riga. Mother said, "Come back to Riga." I told her, "Mama, I'm so happy here." She insisted, "No, you're moving back to Riga." When she went to the rector to arrange my transfer, he said, "You know, she'll regret changing institutes." My mother told him, "You used to be kinder." He replied, "Blue eyes, second row on the right." He recognized her by her eyes. My mother had gorgeous blue eyes like 2 deep pools. You might not see the face, but you see those blue eyes. So they transferred me to Riga, and I continued my studies there. My coursework was average. In my 5th year, I took traumatology, thinking I'd learn something there, pick up some skills. But it didn't quite work out. Then, in my 6th year, things changed. Dr. Giegers from the first hospital lived next door to us. Mother said to him, "My Elita wants to do surgery. Could you take her under your wing?" He said, "I already have students, but I'll hand her over to a colleague." And he gave me to Dr. Sizov. I followed him everywhere, assisted him, jumped at every chance to do something. Finally, on January 29th, 1963, I performed my first operation. He kept telling me, "Wash up, drape the patient, keep it sterile, do the anesthesia, make the incision." I did it step by step. I was operating on the patient while he just gave the instructions. This was during my 6th year of studies. When we stepped out of the operating room, people rushed toward the doctor. A woman, some colleagues, asking, "Well, how did it go?" He simply said, "Talk to the operating surgeon." I was terrified, pardon my language, because he could have been in huge trouble for letting a student operate, especially on a colleague's daughter. They turned to me. "So, how did it go?" I said, "Everything is normal. Everything is dry. Nothing ruptured. Blood pressure is stable." I was more worried about the doctor getting into trouble than anything else. And well, from there, everything just kept moving forward.
Tell me, doctor, how did you begin your medical career? You graduated from the institute. Where did you go then? To which clinic and in what location?
Well, yes, I completed my residency at the first hospital, and basically, by the time I finished, I knew how to operate on an appendix, I knew about perforated ulcers, and I had assisted with gallbladder surgeries. My hands had already learned the craft. When I graduated, I was assigned to SETA. But my mother fell ill with arachnoiditis and was granted second group disability, so I had to stay in Riga. But no one in Riga would hire me. There was no place to start. I begged for something closer to Riga, and finally, they gave me Tukums. On October 16, 1963, Dr. Isles saw me off at the station, and I headed to my first job. There was a very good surgeon there, a wonderful surgeon. But it was 1963. In 1957, his brother, who was a Forest Brother national partisan in Latgal, had been shot, Edgar Janovics. When he found out that a Russian-speaking person and, on top of that, a woman was coming to work for him, the nurse later told me he raged through the surgical department, threatening to resign, furious that they were sending him a woman and a Russian speaker as a surgeon. When I arrived, he wouldn't speak to me. He wouldn't come to assist. I did everything with just the nurse. My first serious case happened after a shift when Dr. Pilsetniks handed over a little girl to me, about 5.5 or 6 years old. He said, "She has abdominal pain." She was brought in around 7:30, and I admitted her at 8:00. He told me, "Watch the dynamics since you saw her at admission." He was in the X-ray department himself. I called him over again and said, "Put your hand here. You have to feel the dynamics in a child." In the end, the symptoms worsened, and we decided to operate. I operated on the girl. The surgical nurse kept nodding at me, and I wondered, what is happening? A 5.5-year-old child. Everything is so small. I was literally jumping out of my skin with effort, but I performed a beautiful surgery. When I had applied the dressing and turned around, I saw Dr. Pilsetnikes walking away from behind the curtain where they wash their hands. It turned out he had stood behind that curtain through the entire operation. Nurse Irma, his wife, had been nodding the whole time so I would understand I was doing everything right. He had stood there watching. What will this ship do? Barely arrived and already operating. And so, on November 5th, I performed that surgery, and on November 6th, I received my first salary. In 1963, I must tell you about Dr. Pilsetniks. He played a huge role in my life. He never pointed a finger at how things should be done. He was one of those who had been deported. During the rehabilitation period, they were allowed to live 100 kilometers from Riga, but not in Riga itself, so he lived in Tukums. Irma was the surgical nurse. They had met in Mordovia. Once I had a tractor driver who had cut his right hand. The muscles were damaged. He had been drinking for 3 days, and when he finally came in, his finger was just hanging there. Everything was infected. I cleaned the wound until it healed, but afterward he kept coming back and saying, "I'm a tractor driver. I can't work. Doctor, do something." I went to Pilsetniks and said, "Doctor, the tractor driver needs to grip the handle. The muscles have healed. Maybe we can sew something so the finger moves?" He looked at me and said, "Come to my house." I went. He had a one-room apartment, a table, a small desk, a sofa, a small dresser, and everything was piled high with books and journals. He said, "Choose. Here is everything on hand surgery." I asked, "But the foreign languages?" He replied, "An educated person must master foreign languages." I translated with a dictionary, searched and studied. In the end, I sutured the muscles. He never showed me with his finger. He made me dig through the resources and find the solution myself.
Tell me, Elita, what were your first steps in oncology? So, your first steps in practical medicine were in surgery, and then, at some point, you moved from Tukums to Riga and began practicing oncology. Tell us, how did that happen?
My mother arranged with the chief physician for me to be hired for 3 months while the gynecologist was away on courses. But I didn't like gynecology, the way the uterus flew left and right. The surgery there was very strong, but I didn't like the philosophy of it, that the uterus gives life and then it's just removed and discarded. Well, those 3 months passed and I had nowhere to go. There was a vacancy in radiotherapy. I had no other choice. I didn't have a surgeon's certificate. Edgar Janovics wouldn't let me go to the certification courses, saying, "You're smart enough as it is." But without that paper, I couldn't go anywhere. I went to the chief physician of the first hospital. It was Dr. Bergmanis. I said, "Dr. Bergmanis, I spent my entire 6th year on duty here, and I've worked as a surgeon in the district for 3 years. Please take me on even for a half-time position as a surgeon." He replied, "In my clinic, only men and Latvians work." Well, I got a punch in the nose there. While I was still working in the district, I gave a presentation at a conference. I analyzed 100 cases of children with abdominal pain. I broke down who actually had appendicitis and who didn't, and what can be determined through examinations. I emphasized that you shouldn't rush into surgery. Just because a child's stomach hurts doesn't mean it's appendicitis. Surgery is surgery. I had very good people around me, and after that conference, I went from the district to see Professor Bizinch. Professor Bizinch always wore very beautiful shoes, beautiful socks, and perfectly pressed trousers. He had this habit. He would sit on the edge of the table and swing his leg, and everyone in the front row would study his socks and footwear. I went to see Professor Bizinch. My presentation had been praised. I felt like I had wings. I arrived and said, "Professor, I really want to join your clinical residency." He said, "No." I asked, "Why not? You have an advertisement out for clinical residency." He said, "In my clinic, only men and Latvians work." And he just kept swinging his leg. I turned around and left. What else could I do? Then an opportunity came. My mother arranged with the chief physician to take me into gynecology temporarily and then into radiotherapy. I didn't like radiotherapy, but I didn't know much about it back then.
So, that was your first real encounter with oncology, correct?
That was my first contact with oncology, but I didn't like radiotherapy. I simply didn't know it. I started reading, digging, and researching everything. One day we had these curatorial trips. We had to visit regional districts to check on the local oncologists and how preventative screenings were being done. I went to Gulbane and met Valdez Bruns, an oncologist I knew from the first hospital. He said, "Yelia, come join me on my rounds." And I found that I could suggest something for almost every patient. Listen, give this one these vitamins, give that one something else. I felt like I had wings because my experience was useful to a colleague, because I had something to give back. When I returned, a few days passed, and on Monday I came into work. I saw the department head sitting there with one of my patients. The boy had just been conscripted into the army and was brought from the military hospital. He had a nasopharyngeal tumor. I had been treating him with radiation. There he sat, one eye closed, lymph nodes bulging from his neck, pressing against his trachea. When I saw him, I knew he was a lost cause. The head of the department asked, "Well, what now?" and answered himself, "This is your first, but it won't be your last." He opened a suitcase, pulled out a bottle, and poured me half a glass. "Drink this, daughter." I drank it. It hit me straight in the head. Still wearing my white coat and cap, I ran from Talsu Street to the park, not knowing what to do. I was in despair. I felt so sorry for that boy. I told myself I would never work in oncology. Finally, a thought clicked. Go to the first hospital. I went there and saw Dr. Pormalis, the head of the 12th department. As I walked, I was swaying from one wall to the other. He stopped, looked at me, took me by the shoulders, led me to his office, and gave me some tea. He asked, "What's wrong?" I couldn't speak. Finally, I blurted out, "I won't work in oncology. I can't bear it." He put his hand on my shoulder and said, "It's too late, daughter. You are already an oncologist if you grieve for your patient like this." Those words went so deep that I couldn't argue. I surrendered. I realized it was my destiny. After that, he helped me get shifts in surgery, but I continued working in radiotherapy. Then my lymphocyte count spiked. I was sent to Professor Ivarkovskis. He performed bone marrow biopsies on my breastbone and hip. I was lying in the ward, and an old woman passed by the door whispering, "Oh, so young and already with radiation sickness." I could hear her whispering. The professor told me, "I cannot say for certain that you have radiation sickness, but your lymphocytes are reacting. This work is not suitable for you." I walked out of that office and realized I don't need anything else. I am free. They won't force me to work in radiotherapy anymore. Before that, the chief physician had summoned me and said, "In the autumn, there will be courses in Leningrad for radiotherapy. I'm sending you because I plan for you to become the head of the department." I told him, "I don't want to." He snapped at me. "What do you want then?" I said, "Surgery." He was shocked that I would tell the chief physician, "I don't want to."
And then you moved into surgical oncology?
In the autumn, there were admissions for clinical residency and postgraduate studies. I had already passed the mandatory exam in Marxism-Leninism. I planned to go for the postgraduate degree, but Dr. Zurinch was sent to Moscow as a national cadre. So they gave me the residency instead. I spent 2 years working with Dr. Sepri. Those were wonderful years. I did everything. I operated alongside her. I was a surgeon. I learned all my skills directly from her. When I was sent back to Talsu Street for 2 months during the summer, my mother and I were working at the same table. I was working very fast. My mother would grab my hands and say, "Don't rush." I'd reply, "I'm not rushing." But I had learned from Dr. Sepraide how to work swiftly and efficiently. I also remember another moment from Dnipropetrovsk during my 3rd year. The instructor asked, "Who wants to be a surgeon?" We raised our hands. They took us to a factory on payday. The workers were drunk and filthy. There was a special room where they were lying. We were told to clean them up. The instructor said, "You must not feel disgust. You must take a person exactly as they are." And then she asked us once more, "Do you really still want to be surgeons?"
I know that you are the first person in the world to have applied an oncolytic virus, virotherapy, in clinical practice. You started this with the Rigvir virus, and to me, it seems like something truly fantastic, especially back in those distant 1960s. Please tell us, how did your introduction to Rigvir happen? How did you first encounter it? What were those first steps, that first experience like?
I was working at the oncology dispensary on Talsu Street in the second department. The head of the department was Dr. Pridite, who was very close friends with Professor Muceniece. By the way, we had this routine. Once a week, Professor Muceniece would come to see us, and an English teacher would come as well. The three of us would study English together. We weren't incredibly close, but it was our shared moment. There was a sense of equality in those lessons because none of us were particularly proficient. Dr. Pridite and Professor Muceniece were constantly talking. One day, Dr. Pridite called out, "Colleague, come over here." I walked over. They told me that there were no side effects, but they needed to verify that. I had to monitor everything: temperature, white blood cell count, general well-being, and so on. Everything had to be strictly controlled.
Like egg clinical research?
Well, it already was a clinical research. I simply interjected into their conversation, and then she said, "Well then, please, here is the list of patients." She selected the patients who could receive it, where we could try it, those in a normal, stable condition, so no harm could be done in case there were any side effects. Because it was the first clinical research of its kind, the doctor said, "Here, this list, these patients." Since I had overheard most of the conversation and understood what it was about, I found it incredibly interesting, of course, but one couldn't get ahead of oneself. When she told me that I could take those patients, follow up with them, and check everything, I was happy. I would be doing something extraordinary, and I had been entrusted with these patients. I performed the injections myself. I checked myself whether there was a local reaction or not, whether there was a fever. I controlled everything and wrote the protocols. The beginning started with me. Later, Garklava and Kopena joined in. They selected patients based on their blood composition, determined who needed it, prescribed the therapy, and then either they or the nurses took over, but all the first patients came from my hands. I asked each one, "How are you feeling? How are you sleeping? How is your digestion? How is your urination? Do you have an appetite?" I asked about everything because I was terrified of doing harm. That was something I had been taught since childhood: do no harm.
Well, as Hippocrates said, first, do no harm.
Yes, but you have to understand, when you've spent your whole life doing things in a certain accustomed way, and then suddenly there's this unfamiliar foreign substance being introduced into the body.
Which year was that?
I don't remember.
Those were the 60s.
Yes, the 60s.
So, what was that first experience with those people like?
Everyone was fine. Normal temperature, no local reactions, no chills, no fever, no nausea. Everyone felt very good. I wrote all those protocols.
How many people were there in that first group?
There weren't many patients, not many with melanoma, maybe 5 or 6. It was melanoma.
And that was on Talsu
Yes,
Street,
on
correct?
Talsu Street.
At Stradinge Hospital. On the other hand, there were various other types of cancer.
I didn't work at Stradinge Hospital myself, but there weren't that many cases of melanoma there. However, there was one particular patient. Dr. Pridite and Professor Muceniece were also involved. She had disseminated metastases in her lower leg and groin lymph nodes. The primary site was below the knee. I had been to a conference where I heard that in gynecology, chemotherapy was being administered endolymphatically, through a canal, for example, in cases of gynecological cancer. I came back from that conference and started thinking, perhaps we could administer prospadine endolymphatically to this patient. Everything was so widespread that surgery wasn't an option. The person was practically doomed. Prospadine was one of the preparations available back then. Administering it endolymphatically isn't easy. You have to find that tiny vessel to get in. Thank God for Dr. Duda, who performed wonderful lymphographies alongside Stengrovics for breast cancer. I called her for help, and she showed me how to do it. I started administering prospedine, and it worked. Then, somehow, the idea came up in conversation. Maybe we should also give Rigvir for the immune system, since prospedine was doing its part. We started using them in combination, and the combined therapy worked well. But there were very few patients, only about 4 or 5.
Well, at that time there were only about 20 cases of melanoma per year per 100,000 people in Latvia. This year, there are already 200.
Yes, but back then there were very few patients. My fingers were itching. I would have done more and more, but there simply weren't enough patients.
And in the further clinical course, initially, it was within the framework of a clinical research, but you have been in contact with Rigvir throughout your entire career. How did it progress from there? In which cases did you use it? How did you select the patients?
While I was under Dr. Praditi's wing, everything went through Kopena and Garklava. They prescribed the therapy. I simply followed the patients clinically, seeing how things were, what was happening. In any case, I saw that the process would stop or at least slow down. And for an oncology patient, that means a great deal. Everything that came from Professor Muceniece and Dr. Pradite, I took to heart. Dr. Pradite was a woman of few words. It's an irony of fate. She was dismissed from the Institute of Traumatology for nationalism and ended up on Talsu Street. And then the Russian-speaking Shapovalova arrived at Talsu Street, and we worked together. How they put up with me, I don't know, but she never said good or bad. Once, I was operating on a young woman, 36 years old, breast cancer. Professor Rutkin's brother was assisting me. The surgery went layer by layer, cleanly, the vessels almost presenting themselves. I was practically dancing at the operating table. Everything went so well. Rutkin stood there and said, "Well, look at you go, look at you go." That was the only thing he said. In my wooden clogs and lab coat, I ran to the ward's break room where Dr. Predit was drinking coffee. I burst in and said, "Doctor, thank you! My surgery was a success today." I wanted to tell her how grateful I was for everything I had learned from her. She just looked at me and said, "You've been operating beautifully for a long time now." Never once was it said, "You did well," but that one sentence meant the world to me.
Tell me, what was your relationship like with my grandmother, Aina Muceniece? I understand it was all through the prism of Rigvir. How did it happen, and how did your friendship develop?
See, I can't tell you the exact year, but it was through Dr. Pradite, as she was very close friends with Professor Muceniece. Later on, we even had English lessons where the three of us studied together. But that was later. In any case, when the professor told Dr. Predit, the head of the department, about it, she simply said, "All right, Dr. Shapovalova will observe those patients." I was given a list. I had to monitor their temperature, local reactions, general reactions, and record everything in writing. That's how it began. Professor Muceniece used to come to our ward. She was a very warm person. You didn't have to knock on her soul to get through. She was very open.
On a purely professional level, did you share the same patients?
Well, yes, all the patients, of course.
So, everyone who was under her care was also under yours.
Yes, we had shared patients. And then, when her husband was ill, I think he was already close to the end. I couldn't find her anywhere. I called the institute, the oncology department. Nothing. They told me she was probably with her husband. I went to Strattonge Hospital. Her husband was lying there with his eyes closed, but she was sitting right beside him, working. All around her were stacks of papers, results of lymphocyte and leukocyte analyses. She just kept on working. That surprised me greatly. But later I thought, she is sitting there, and regardless of whether he opens his eyes or not, she is present. And at the same time, she continues to do her work.
Was your relationship strictly professional, or was it more of a friendship?
She was very kind to me, but how could I be friends with her? I idolized her. She was so good. She would answer any of my silly questions. You could ask her anything. Dr. Pradite was very composed, more reserved. And I'm telling you, I will never forget that finger as long as I live. But Professor Muceniece was supportive. If an idea came to my mind, she would say, "Yes, that might work."
Did Muceniece also teach you anything about immunology?
No, not specifically.
And what was your experience like collaborating with the patient she sent to you? Was the Rigvir virus administered before or after the surgery?
Well, in the beginning, we developed a combination. I would administer prospidine. We also gave Rigvir in advanced cases, but there were very few such patients. If there was a primary tumor, I tried to administer Rigvir before the surgery so that the lymphatic pathways would be rinsed as a prevention against metastasis. But you have to understand, there were very few patients back then.
And later in your career, you mentioned that you moved from the oncology center, moving away from surgery toward the oncology outpatient clinic, correct?
Well, they transferred me.
Did you have further experience with Rigvir there in the outpatient clinic as well?
There was Dr. Proboka. She worked extensively with these patients. They were our shared patients, but they went through her more. I will tell you this, practically no one has done as much as she has to implement Rigvir in practice. She selected the patients, looked after them, dealt with them, determined who needed it and who didn't, and she is still working today. I simply pray to God that she is allowed to work for a long time and that she isn't eaten alive. She has courage. As for others, I don't know. We had few shared patients because if I had patients, I would send them to her.
Speaking of the Rigvir virus, you already mentioned observing severely ill patients and noting that there were no side effects. Nothing bad happened to them, and the tumor process would stop, with remission setting in. Do you have any other stories or cases that you remember from later years? Not just from the initial clinical trials, but from your subsequent clinical practice. Did your colleagues have so-called success stories? Can you tell us about them?
Yes, I was riding on a trolley bus and someone said to me, "Hello, doctor! Hello! Don't you remember me?" I said no. She said, "Well, how can you not remember? She was almost ready to lift her skirt right there. I had a melanoma on my back. You operated on me and then gave me your preparation." She was all set to show me the scar. See, I am alive and well. It's fantastic. I didn't ask her how many years had passed, but those eyes, happy eyes that she had been living for so many years. And another one, a young Romani man was sitting across from me, making faces at me the whole time. People sitting nearby started noticing that he was staring and gesturing at me. I thought, what does he want? I don't know him. Then he said, "Well, don't you remember me?" I said, "How could I?" He said, "But you treated me." I asked, "Treated what?" He said, "Well, you treated my backside." And he was already standing up to show the scar. I said, "I believe you, I believe you. The main thing is, you are alive and well." Then it clicked. Back then he was just a boy, but now he was a man.
But isn't that a miracle in oncology? Two things. First, there are no side effects. And second, as an oncologist, you can actually meet your patient again after many, many years. That is true happiness, especially in oncology.
It is happiness. I told you about that woman who came in with breast cancer. I said something to her then, and she said to me, "You told me those exact same words 40 years ago." For 40 years she remembered my words. That is very important.
Now, a question about the virus itself. Did it not unsettle you that you were working with a live virus? Were you aware of the mechanism of action, how it works, what it does? Were you not afraid to inject a patient with a live virus, given that practically no one in the world had done it before you? In the beginning, I understand there was the unknown, but later on, how was it? What was the feeling of working not with pills, but with a living virus?
Absolutely no fear, no doubts, no thoughts that it could cause harm. An ampoule is an ampoule, an injection is an injection. If it brings health, how can it be harmful? By that logic, you shouldn't even be injecting vitamin C. I had complete trust. I can't even say the thought that it could harm the patient or myself never even crossed my mind. I didn't think about it.
But did you have an understanding of the virus's mechanism of action at that time?
Only as much as the professor told me, and as much as Kopena and Garklava explained, just as much as they told me back then.
In the world today, therapy with live viruses still seems like a brand new technology to many. Rigvir was the first virus in the world to be registered as a medication. And for people, it's almost hard to imagine that back in the 1960s, here in Latvia, Dr. Elita Šapovalova was already injecting a live virus.
Now they will know.
You were 100 years ahead of your time, and Rigvir is still ahead today.
You know what I will tell you? I am only grateful to fate that it brought me together with Dr. Pridite, because all those injections were done with her blessing, and the patients were given to me by Professor Muceniece. She was like a sun that illuminated everything, and most importantly, we were able to help the patients. That is the main task of our lives.
Yes, you mentioned a blessing. And do you remember? 2 years ago, I also came to you to receive a blessing. Not for a Rigvir injection anymore, but for the Rigvir capsule. It was very important for me to receive that blessing from you. My grandmother was no longer here, and I consider you her deputy here on Earth. Like the first person on the moon, that's how you were. The first to work with a live virus. You gave that blessing, and now the Rigvir capsules are going further into the world. They are used by people who don't have cancer, but are at high risk. And here is my question. As an oncologist, how do you view the further development of Rigvir capsules in cancer prevention? In your opinion, how important is it to work with healthy people, the use of Rigvir for healthy individuals?
I will tell you this. After what happened with COVID, the number of oncology patients will certainly increase. COVID severely weakens the immune system. Therefore, for patients who have gone through COVID, it would be advisable to support their immunity. If something is sitting somewhere in a cell, then as immunity drops, it can raise its head and become active. You will see the statistics. It won't be long after the epidemic before the incidence of oncology increases.
Do you believe that Rigvir can help stop the spread?
It supports immunity. COVID itself suppresses the immune system. When I had students, I used to explain it to them like this. Imagine it's winter, there's snow. Three boys, the same age, from the same class, from the same backyard, are playing outside. Then they are called home. One comes home and eats a whole pan of fried potatoes. The second says, "Well, I don't really want to," but he's persuaded and he eats. The third says, "No, I don't want anything. I'd rather go to sleep." Three children, identical conditions. But each has their own immunity. The one who eats with appetite, his immunity is holding strong. The one who wavers, his immunity is swaying. The one who refuses food and wants to sleep, his immunity has already dropped. That's how I explain it.
The Rigvir capsule is a fairly complex technology intended for cancer prevention and for people at high risk, those with high genetic risk, elevated markers, or precancerous conditions. But we are going even further. We have created a new form of Rigvir, a liquid dietary supplement that is significantly more affordable. It will come in a bottle like this, and our goal is for it to become widely available across the globe. The idea is simple. The more people buy it, the more accessible it becomes. Do you believe in the idea that with this virus, which can multiply infinitely, like a God-given little virus, we can actually reduce the prevalence of cancer in the world?
I believe, but you cannot save the entire world. If you take people who have gone through COVID and give one group the preparation and the other group nothing, and then compare the results after some time, you will see a difference. I believe that for those who receive the preparation, the development of oncology will be less frequent or delayed.
We will work on that. But we also want the product to be financially accessible to many. Would you give your blessing to this liquid product as well?
Is it drinkable?
Yes, it's drinkable.
Well, that is wonderful. If it's drinkable, it doesn't involve injections or the need for someone else's help. A person who wants to be healthy will follow the instructions, how and when to use it. I believe that for those who use it according to the instructions, it will be helpful.
Yes, and according to Muceniece's teaching, Elita, I know that you deserve the Nobel Prize for your contribution to oncology, helping cancer patients for 60 years. I believe such a long career is rarely found anywhere in the world. I am curious, how did that moment happen when you left oncology? How did you leave the oncology center? I understand it was 2 years ago, exactly after 60 years of service. What made you decide to take that step?
I had to go see the occupational physician. We talked. She told me, "You can no longer work." I asked, "Why?" She explained nothing, not a single word. About a month and a half passed. I went on vacation. When I came back, it was in November. There was no one at my door. The computer was empty. I stood there and thought, You know, what saves me is that as a surgeon, I know how to make decisions on the spot. I stood there and thought, 83 years old, it has to end sometime. I don't need a heart attack. I don't need a stroke. I'm not going to go and demand explanations for why everything is closed. I turned around and walked away.
But were you ready to continue working?
Yes,
When you think back on these 60 years in oncology, are you overcome by a feeling of happiness?
you know, happiness comes from those people who live and who trust. The tragedy is that patients don't always trust their doctor, and doctors don't always know how to approach a patient. Dr. Zelitis once told me, Elita, your blessing and your curse is your empathy. You take too much upon yourself, and you give too much of yourself to the patients.
But isn't that the right approach to treatment?
I don't know any other way.
I don't think there are many oncologists in the world who, while practicing chemotherapy, meet their patients on the street after many years and have those patients bring them flowers or chocolate. I don't think there are many like that.
Everything depends on human relationships. I told you, we were raised to be able to endure everything. My mother told me, you must see the human in every person, no matter who they are. That is one thing. The other thing, I loved ballet. I truly adored Maya Plesetskaya. I saw her perform and was in awe. When I started working, my mother asked me, do you remember Maya Plesetskaya? I said, yes. Do you remember the corps de ballet? I said, no, they all looked the same. And mother said, you see, you remember Maya Plesetskaya? When a patient comes to you, you must be in your place just like she was in hers. You must give everything, your talent, your knowledge, your capabilities. You must be the Prima. Everyone else will help, but you, in your place, must be the very best. She put that so deeply into my head.
So, the doctor is at the center, not the oncology center or the Ministry of Health. A patient comes to a human being, don't they?
Yes, a person comes to a person.
Elita, we talk so much about oncology. Did you also have time for a family?
I live with a sense of guilt. Now, as an old woman myself, I understand my husband. I understand how foolish it was that we divorced. But you can't bring that back. I am so grateful to my husband. He used to come and sit on the first floor at Telsu Street, waiting for me to finish work. The chief doctor's office was right next door. Once she came out and asked, "Why are you sitting here?" He said, "I'm waiting." "Who are you waiting for?" "Dr. Shapovalova." They already knew him. Once the chief doctor called me in and said, "How long is he going to sit by my door?" "Who is he?" "Your admirer?" I said, "What admirer?" He always stood up when I approached as if he had just arrived, but he was very persistent. That's how we got together. But you know, all my hormones and all my energy were working for the job. I am grateful to him that I have a child. I don't know how happy he was with a mother like that, but to me, it was a miracle. I was 38 when I got pregnant. Everyone around me, the head of the department had 2 kids, the anesthesiologist had 3. Did anyone tell me, Elita, slow down? No. In surgery, everything went like a song. I operated from morning till night. No one stopped me. No one told me, protect the child. I ran, I operated, I lived at work. I remember in January, while on maternity leave, I went to Gurmala to Lailupi. I walked all the way to the river and back. Suddenly I stopped. I couldn't move. The baby had turned in a way that my legs wouldn't work. An empty beach, January, not a soul around. I stood there and thought, how do I move? Suddenly, from nowhere, a small man appeared. I said, please, come here. He almost wanted to walk past, probably thinking, who is this crazy woman? I said, help me, please. He came over. I said, move my legs for me. Without a word, he picked up one leg, then the other, and I could walk again.
Isn't it true that you have one son, Pavel?
My other child passed away. That was very hard for me.
My grandmother used to say that she had 2 children, and the third was her work. Was oncology like a child to you as well?
I feel guilty, but for many years, oncology was everything to me. I had those maternal feelings even earlier. When my sister was born, she was born at home. My father chased me out for a walk. I wondered, why am I being kicked out of the house at 12 o'clock? Then he called me back in, led me to the bed where a little bundle lay, and said, "This is your sister. Love and protect her." And I nursed her because mom and dad were working. She was like my first child. Later, she had 2 children of her own. She traveled from Moscow to Riga just to give birth, and again, I was the one nursing them. Those maternal feelings of mine were distributed to my sister and her children. For my own, I suppose there was very little left. Only later, with my mind, did I understand what that truly meant.
Elita, how do you look at your life now? You started working in the 60s. That's when real adult life began, with all its responsibilities and choices. Now the world is completely different. Phones, internet, CT scans, modern technologies. How were you able to work with oncology patients back then? Not just to help, but to actually cure them. Through today's eyes, it seems almost impossible. How does it look to you, looking back? What were the greatest challenges of that time?
Analyzing retrospectively, I can say, I got through it on my empathy. This is not boasting, but there was almost always mutual trust with my patients. It helped us understand each other. It helped me put the person in their situation, to accept the diagnosis, to accept that it is what it is, and to direct them toward the fight. When a person heard me and was ready to fight, I did everything I could for them.
I see a huge difference. Today there are guidelines, protocols. Everyone is sent through the conveyor belt. In those days, half the victory was having the person at the center, instilling faith and working with them.
First, you have to believe and fight yourself.
So, even without modern technologies, it was possible to achieve very good results. And also, where did you find the strength to work in oncology for 60 years? People today retire at 60, but you worked even past the age of 80.
I drew my strength from the patient.
So, that's how the feedback loop was formed.
Yes, that is the feedback loop. From their eyes, from their trust. When I presented a diagnosis to a patient, I immediately said, "Yes, this is the diagnosis, but we will do this and that, and you have these specific choices." I immediately oriented the person toward the fight. Often they didn't even have time to collapse from the diagnosis because they were already armed to fight on. It is a psychological moment, one that must be caught.
In those days, was that exchange of energy unique to just a few doctors like you or, for example, my grandmother Muceniece? Or was it the approach of that time? Individual work with the patient?
Oncology in our family started with Dr. Hersfeld. When we arrived in Riga in 1950, my mother didn't know Latvian. She couldn't find work as a surgeon, so she started working in the ambulance service. Twice she brought in patients with correct, precise diagnoses, and both times Dr. Hersfeld was on duty. He asked, "Where did you graduate from? With such knowledge, you should be working in a clinic, not in the ambulance service." He went to the chief doctor and insisted that my mother be hired on a probationary basis. I often visited the ward. Once at school, I had a conflict with my physics teacher. I was at that teenage age, and he labeled me as a bad student. One day, I got a call. "This is Dr. Hersfeld. I am expecting you in my office today at 5. I went, and he gave me a real dressing down. He said, "Do you understand where your mother works? She is on the front line. She fights for every patient. And you, like a saboteur from behind, are causing her trouble with your grades. If she worked as sloppily as you study, there would be nothing but coffins lined up at the door." I learned physics. Dr. Hersfeld was that kind of man. He had 40 patients in the ward, and he knew them all by name. He spoke with everyone. He said, "Every patient is a human being. You must treat the person, not the disease. Everyone has their own character, their own fears, their own pain. You must find a connection." He put that into my head for life.
The way you described that time, the patient at the center, the exchange of energy, personal responsibility, differs greatly from today with its guidelines, protocols, and systems. Often, these guidelines are not even written by doctors. What do you think? By moving in this direction, does oncology have a future in the sense that we can stop the spread of cancer in the world? Or do you have doubts about this?
No, I feel that oncology on its own will not win. You see, there are so many factors suppressing the immune system. Everything around us, the atmosphere, the earth, what is happening above the earth, we do so much that suppresses both our own immunity and the immunity of the earth. And as long as this continues, with wars, explosions, stress, these are all immunodepressing factors. Morbidity will increase not just because of COVID, but because people live in constant tension and suffering.
And in this context, Rigvir, as a live virus that stimulates the immune response, how do you see its future? How would you like to see the future of Rigvir?
I think that during the COVID epidemic, many patients would have needed Rigvir. But who will give it to them? Where will they be able to get it? How will they even know that such an option exists? I believe it will move forward. It will claim its place. Times simply change. I hope a time will come when there are no obstacles to what can help people strengthen their immunity and protect themselves. Whether I will live to see it, I don't know, but I hope.
God grant you will live to see it. As we discussed, in other forms, it is already more widely available in the world.
Well, yes, except for Latvia, but time will put everything in its place.
Tell me, what would be your words to a young person today? A 20-year-old who is just starting their journey? Today we have TikTok, the internet, and all kinds of coaches who teach how to make money and say, you can do anything. But life wisdom, like yours, seems to be a rarity. What would be your advice to a young person? Purpose, persistence, humanity, courage. What other values would you pass on to them?
First of all, protect your health, for it is a gift from heaven. Everyone has their own limit, their own endurance. Secondly, remain human. Humanity and human relationships determine so much, even the atmosphere around us. If people treat each other humanely, there will be more peace. Peace is needed. Peace. When we were in Mongolia, I was 4 years old. I remember that. The Japanese were there. I walked past 2 Japanese soldiers. One looked at me in such a way that I stopped. When I stopped, he began to cry. I gestured with my hand to comfort him. Don't. I came closer. He took my hand and touched my fingers with his fingertips, and his tears were flowing. I don't remember if he was gray-haired or young. I only remember those crying eyes and how he felt each of my fingers and wept. Then I was called and I left. Later I asked my mother, why was he crying? It doesn't hurt. Mother said he remembered his family. Peace and love.
Nothing more is needed.
Love those who are beside you.
Actually, I feel that way too. Perhaps we cannot save everyone, but we can alleviate suffering and through that, increase love.
Through that, increasing love and life.
Thank you, Elita. Thank you for coming, for finding the time. Peace and love in every home. Thank you.
Thank you. You have turned my soul around a little.